Hello everyone, welcome to all of you onto my YouTube channel. And this is Dr.Sourabh Kosey. And today we're gonna discuss about the drug distribution system in the hospitals, as well as lecture number 12, hospital pharmacology. So welcome to you all, and my sincere acknowledgement to the ISF College of Pharmacy. And particularly, this is one of the institution with the great reputation in pharmaceutical education, sciences, and research. So my acknowledgement, sincere acknowledgement to the management, Chairman Shri Praveen Gargji, Honorable Chairman of this institution, Engineer Janesh Gargji, Secretary and Chairman TLF Global Learning Field, Professor G.D. Gupta, Director cum Principal, ISF College of Pharmacy, Professor R.K. Narang, Principal, ISF College of Pharmacy and Research, Moga, and to all the HODs of the departments, various and students, and all dear, lovely participants of this pharmacy practice masterclass being conducted. So I would like to welcome you all once again. So we today gonna discuss about the drug distribution system in the hospital pharmacy. So in our typical daily life system, we have seen that the concentration of the medicines and its distribution system has been a very wide role playing into the particular prospects of drug distribution system. So modern medicine system, they are the processing of the understanding of the this knowledge based system where morning time, evening time, bedtime, every time we are in the requirement of pharmacy. So pill pro, pill box, and there are n number of things at the level where we are in the requirement of medicines. So drug distribution in the hospital, at hospital pharmacy, at ambulance, at store, at emergency, at floor stock system, at satellite system, at various places, this is required. So this is called as dosage box, available in the particular setup of hospitals where the medicines are being stored. And Pill Pro likewise available on Amazon, and certainly this is one of the nowadays available units used for the purpose of the medicine safety. So certainly crash cards, the emergency medicines are stored inside the hospitals for the purpose of this medicine putting at every point. So medicines are the safe substances, they are the prescription drugs, they are the over-the-counter drugs, they are the club drugs, they are the narcotic drugs, psychotropic substances, and of various category. Also, we should understand that the medicine starts from your house as OTC. It's go with Eno, ORS, Vicks VapoRub, and painkillers, anti-allergics, and it's until the last line or emergency line in the emergency drug. So zero line over the counter, first line acute, second line subacute, third line emergency line. And in whole prospects, we need to see that medicines are an integral part of the life. So in our context, we need to see that the medications are being given in this cash card are in various capacity of particular region, and this capacity is termed to understand that the molecules which saves the lives are put it into the crash cards. So crash card or emergency tray in government hospitals, if we go, it states this. So this is one of the thing which is stated. So crash card. Then comes the next thing, which is crash card means in the card there will be a particular willy, and in the willy you have the medicines, and these medicines are gone from one place to another place, and this willy have the whole capacity of putting the medicines at one place, and thus medicines can be a life-saving drugs at any part, or with automated external defibrillator, with various emergency medicine drugs like If I talk about the medication chart review, and in the medication chart review, if we go with the medication perspective, we need to understand that various scheduled medicines are available. And into the emergency drugs, when you have adrenaline, lidocaine, amiodarone, calcium gluconate, furosemide, atropine, dopamine, noradrenaline, adenosine, metoprolol, dobutamine, dexamethasone, hydrocortisone, midazolam, tramadol, sodium bicarbonate, extra, etc. So the medicines which preview to have life-saving activity in particular. So these activities are at a concentrated level to understand that the medicines are the safe zone. So the medicines which in category in particular understands that we should have a emergency this trolley to save these medicines, and 108 ambulance at hospital, also emergency medical services. In that ambulance specifically, the molecules are embedded into the proportion. Then the next part, which is a trolley, and into the trolley section, the medicine is distributed into the hospital into the various categories. Then some distribution in the TB, tuberculosis cases. So RNTCP, Government of India guideline, directly observed treatment, short course and plus. Both way, the kits are in the red and the blue kits. Then the drug distribution system, and in the drug distribution system, outpatient and inpatient services are in a specific manner. So in India, if we talk about the medications, we need to introduce this hospital drug distribution system, the provision in which the medicines are given in the wards, in the outpatient, in the inpatient, in the indent. So outpatients, if I talk about the categories of outpatients, they are emergency, tertiary, primary care, ambulatory care. Everywhere the medicines is required. Okay, so unit dose, double dose, then storage in particular of labeling also required. So outpatient, inpatient, whereas inpatient are intensive care, cardiac care, neurology, nephrology, urology, ophthalmology, orthopedics, skin and VD. As per the different organ systems of the body, they are admitted, and they have proper their own system into the inwards. So mobile dispensary unit is specially constructed with the stainless steel truck, and it's measure 60 inches high, 48 inches wide, 25 inches deep. Then you have the bins for the medicines collection and distribution into the individual wards. Into the hospital pharmacy, apart from in and outpatient, ambulatory patient and controlled drug patients comes up. So inpatient is some patient where they are inside the ward, and a nursing station is there, and nursing station at nursing station part, the nursing staff is taking care of the patients for properly giving up the medication level. So medications level in this aspect, the medicines has to be given in a proper circuit way. And for that, various references like British National Formulary, British Pharmacopoeia, National Formulary of India, USP, NFI 11, 16, 21. In various categories, this National Formulary of India are available. Then you have current index of medical specialty, SIMS, MIMS, monthly index of medical specialty, drug today in the drug stores, and you have formularies, essential drug list, you have some price control orders, you have some formulas like Drung's, Young's formula, Clark's formulas, Drilling's formula, you have some posology metric conversion charts, and you have to prepare the hospital formulary as this contains the members of pharmacy and therapeutic committee, where the peoples from clinician background, physician background, from various medical legal specialties, they comes up, set up with the pharmacy, and they inform on hospital policies, procedures concerning drugs. So various types of allergens like pollen grains, animals, dust, mist, food, insect stings, latex, mold, etc. are also to be considered during uh, distributing the medicines. So one problem comes up is polypharmacy. Polypharmacy is something when you are mixing up two or more system. then card, then medical record department, then drug store department. Routine ward rounds takes place. After ward round, medication chart review, patient counseling. So everywhere we need to understand patient with what kind of is synergy and strategy patients comes up. They have allergies, they have several drug related problems, they have tends to have belief that without drug they can be very good. So other non-pharmacological therapies like psychotherapies, physical physiotherapy, occupational therapy, acupuncture, radiation therapy, music therapy, aromatherapy, diversion, validation. Then complementary alternative medicines comes. So Ayurveda, Unani, Siddha, homeopathic, aroma, herbal medicine, meditation, chromotherapy, massage therapy, diet therapy, acupuncture, etc. are the various complementary alternative medicines. In psychological health interventions, art therapy, health education, psychotherapy, zoo therapy. In physical health interventions, physical activity, hortitherapy, physiotherapy, manual therapy, thermalism. Another nutritional health interventions, dietary supplements, nutritional therapy, e-health devices, therapeutic games, virtual reality therapy. Other health NP interventions, ergonomic tools, phytotherapy, cosmetic therapy, wave therapy, lithotherapy. Types of allergies, pets allergy, dust, mites allergy, pollen grain allergies, mold allergy, vaccine allergies, drug allergy, sun allergy, photosensitivity, food allergy, chemical allergy, virus allergy. So to understand such kind of allergies and adverse drug reactions and various drug-related issues and problems, as well as the mechanism of action, we need to understand in India there are 4 to 5 type of pharmacy practices practiced nowadays. Community pharmacy, hospital pharmacy, clinical pharmacy, e-pharmacy, and generic drugstores. So WHO has given in 1996 this FIP guidelines, and IPA has given then 1996 a good pharmacy practice manual for community and hospital pharmacy. You have various rules, regulations to use the drugs like pharmaceutical jurisprudence A to Z. For inpatients, a doctor has written a prescription. Then the patient moves to the pharmacy. If the laboratory confirmation of the disease is not there, then we are moving particularly for filling up the prescriptions with the confirmation of diagnosis. So you guys need to understand that whensoever such kind of condition occurs, when we need to see that the molecule has to be at a concentrated level used, it should be going within the rhythm. So in this rhythm, prescription refilling, instruction, dispensing cycle, and while dispensing, we need to also see the dispensing manual procedure and the reissuing, refilling of the prescription, and certainly if a inpatient is there, what kind of strategy and order has to be followed. So in Delhi, Mohalla clinics, medicine vending machine has been inaugurated 5 years before, and it's like a medicine ATM. So in community biometric, if you have this barcode, the medicines will come out likewise. So automated dispensing cabinets, computerized medicine cabinets are also used. Crash card, I told this crash card is particularly for emergency drugs. Then pill organizer, dosage box as per the day is distributed into 3 categories. Then you have this kind of midday, tea time, bedtime, morning time pill boxes, emergency tray for RNTCP drugs, then mobile dispensary unit, drug basket method where a nursing station fills requisition form to deliver these drugs on various floors. And the empty containers, the nurse places the medicines into it and delivered to the floors. So this is for Crown Mart Pill Pro available for 7 days weekly tablet medicine storage organizers from Sunday to Saturday. And the day is divided into 4 parts: morning, noon, evening, and bedtime. And you can put up the medications likewise. Drug distribution in hospital, inpatient, outpatient, and radioactive substances in inpatient, individual prescription, complete floor stock, combination unit dosage form, where a label for a charge floor stock from the ward is prepared. and from that known charge flow stocks, basket method, and mobile dispensary. So this is the drug basket method. This is mobile dispensary unit. After that, the labels for non-charge flow stock, it is particularly prepared and it is delivered. So various different types of doses, forms, and capacities like ampules, capsules, tablets, solutions, powder, etc. are being given up. Then what is the difference between floor and non-floor stock system? So floor stock system is as per the floor medical specialties, a gynecology, ophthalmology at one floor. Another floor is having dermatology and orthopedics. So what is floor stock system? The medicines in which the organ system is involved, that medicines will be subcategorized in the hospital formulary, and that will be stored as per the floor. So the medical facilities where the medicines are employed at a particular floor, that medicines you will store at a particular floor stock is called as charge floor stock system. Non-charge floor stock system is a decentralized one, where at one place only the things are there, and on call, on demand, the medicines will be provided. Then next comes up with the combination of both individual as well as floor stock. Unit dose dispensing, one tablet, one capsule, it is likewise. So those medications which are ordered, packed, handled, administered, charged in multiples of single dose units containing a predetermined amount of drug or supply sufficient for one regular dose. A single unit package is one which contains one complete pharmaceutical doses forms. So for dispensing unit dose, CUDD and DUDD, centralized unit doses drug distribution system, whereas the B is the decentralized unit dose drug distribution systems. So centralized unit drug dose systems, all inpatient drugs are dispensed in unit doses. All the drugs are stored in central area of the pharmacy and dispensed at the time the dose is due to be given. Drugs retransferred from the pharmacy to the indoor patients by the medication charts. In decentralized from one place only the medicines go. So this is a general flow, particularly where the medicines is written by a physician. It goes to the discharge medications in patient received by pharmacist, filling, dispensing, accounting. Then again, if it is written the lab values basis on to the chronicity, the patient is admitted. After the admission, specifically the medicines returns to the credit if it is not used, and if it is used, if the condition is chronic. So outpatient are of 3 to 4 types: emergency, tertiary care, primary care at various clinics, primary health center, community health centers and other places. So emergency or accidental care condition which require immediate medical attention. It may be a chronic health condition, roadside accident, any cardiac arrest, angina, myocardial infarction, or anything. So for outpatient, racks of storing drugs, refrigeration, dispensary office, windows for dispensing, sitting arrangements for patients, outpatient activity chart where the treatment is written by doctor, received by pharmacist, filling of prescription, dispensing of patient, prescription payment, prescription filled, receipt of payment, case change, static report if prescription is filled, regular prescription, narcotic prescription, or revisit prescription. There are a number of prescriptions. So requisition slip for ward stroke control substances. How many number of medicines for controlled medicines like morphine sulfate? Let me tell you guys, the world's first drug is morphine. The world's first drug which was discovered is morphine. So morphine sulfate ampules, phenobarbital, codeine sulfate. Morphine sulfate, codeine sulfate cost 1 kg for 66,000 from Indian government opium factory from Neemach, Madhya Pradesh, Mandsaur. And in drug system distribution in the hospitals, you have inpatients and charging policies, labeling policies, dispensing of drugs to ambulatory patients, hospital pharmacy, where you can see the medicines are stocked, and some preparation of the medicines like chemotherapy agents, radioactive nuclear pharmacy agents, infusions, antimicrobial stewardships, various kinds of dosage forms like tablets, syrups, capsules, ointments, stomachals. Inpatients are those patients who requires hospitalization. So they may be classified as individual prescription order, complete floor stock, combination, and unit dose. So this is already I have discussed individual, complete, charge floor, and what are the medicines which will be inside it? It will be as per the hospital formulary, and the patient is charged for every single dose administered to him, and the various drugs are being asked by the PTC, and drug basket method, mobile dispensary unit. In drug basket method, the nursing staff is the medicines. Mobile dispensary, which is a trolley which moves from one part to another part, and unit doses form an individual one. So centralized, decentralized, outpatient, emergency, where 108 ambulance, pre-hospital emergency manual works, and in tertiary care, particularly big hospital, and into it there are a lot of medical practitioners and specific pathology labs and diagnosis methods are available. Primary care, where only first aid and some concerns can be given up, and location of patient dispensing, it should be at nearer to the may I help you desk or near the parking. Drug distribution to outpatient should be with the dispensing cycle, all 6 steps, where receiving the prescription, handling the prescription, reviewing the prescription, and particularly accounting, billing, and patient education takes place. Dispensing of controlled drugs is a very typical job role, and into this job role, you need to understand, you need to see that responsibility of yours comes up, and in this responsibility section, you have to particularly give the medicines in a very good manner. The Xerox copy of the prescription you should take up. Any neurologist or psychiatrist should have ordered these medicines. So doctor's controlled drug order sheet is given. So this all the drugs in the prescriptions as per the Medicine Act 1956 should be written by the registered medical practitioner. In case of emergency, only the oral prescriptions or the verbal orders are taken and that are annotated. Typically, next morning the clinician has to sign that verbal orders. There are 5 schedules of controlled substances. For controlled substances, rules, laws, and works comes. In controlled drug substances, giving date, amount, patient name, hospital number, doctor, reordering or ordering, signature of nurse administering, frequency, route, everything must be annotated. Most commonly abused drugs are painkiller, opiates, narcotics, oxycodone, oxycontin, hydrocodone, codeine, morphine, central nervous system depressants, sedatives, tranquilizers, hypnotics, barbiturates, mevacrol, nembutal, benzodiazepines, stimulants used to treat attention deficit disorders, narcolepsy, weight loss, dextroamphetamine, dextridine, methyl phenidate. Then ward controlled, pharmacy controlled patient system, ward basket method, then pharmacy controlled ward based impress system. So this all categories where the drug distribution systems works. Where operation theater, X-ray, other clinics have their specialty services to store the medicines, and they have their proper stores because in emergency conditions, medicines may be required in one time. So dispensing of drugs to the inpatients, IV, fluids, parenterals may be required. Now we are coming with the lecture number 12, that is the hospital formulary. So the formulations available in the hospital is called as hospital formulary. So typically, if you go to the international scenario, in the international scenario, WHO model drug list. Then come at the national level, national essential drug list. Then comes up national formulary of India. Then comes up state government urban, suburban, rural population medicine list. And then comes up a hospital list of a hospital which is called as hospital formulary. So there are some factors which depends this medicine to be included into the hospital formulary, like how many patients are visiting to the hospital daily, clinical attendance, OPD. Second, what is the socio-economic status of the peoples of that region? What is the paying capacity? Third, generics are in more requirement or the brands. So again, the socioeconomics and pharmacoeconomics concerns. Then next factor is what are the kind of diseases dominant in that particular region. If it is a tropical area, subtropical area, according to it, the disease prophylaxis happens. Disease epidemiology occurs. So the surgeons, physicians, diagnosticians, pharmacists concerned with the treatment of disease, a therapeutic committee complies the formulary. The hospital formulary system is a method whereby a medical staff with the help of pharmacy and therapeutic committee makes a team, sets, select the medicines on rationality, evidence-based medicine. They want to have non-toxic substances, easily affordable, available, quality, efficiency systems. And the hospital formulary system assists in particularly non-proprietary or proprietary products names in instances where the drugs have both names. The main responsibility of making a formulary is of the pharmacy and therapeutic committee, where they decide which medicines to be included or not. So the first formulary in India was published in 1968 by CMC Vellore, Christian Medical College. And this formulary was the first development where this thing happens to understand that Government Medical College Trivandrum, Kerala again come up in 1997. So this was a milestone in the history of the hospital formulary. So international formulary, national general formulary, state formulary, joint formulary, and hospital formulary are the various types of the formularies. And these formularies are basically the selection of the medicines which are required as per the your region or the area or the hospital or the country, where you need to understand which kind of cosmeceutical, nutraceutical, pharmaceutical, prescription medicines, over-the-counter medicines to be stored at various levels in the hospitals. So knowing all drug-related problems, adverse effects, side effects, toxicity, you need to have the medicines. And the need for hospital formulary, increasing number of new drugs are manufactured every day. A main number of brand names comes. Okay. So to solve this complexity of writing to the physicians which medicines they should inculcate into the prescription, whether it is inpatient or outpatient, both way, this formulary is very helpful. So what are the advantages of hospital formulary? They are therapeutic, economic, education, RDU, EBM, and safety and continuous care. So guiding principle, group of people sit together from pharmacy and medicine background. They make the policy and procedures, development, updatation of the list. And in the absence of written policies approved by the medical staff, the pharmacist shall dispense the brands. The hospital shall make it certain that the nursing personnel must be informed in writing about the hospital formulary system existing in the hospital for its effective uses. In the formulation of policies, procedures, the term substitute or substitution should be avoided because these terms can be used for dispensing entirely different drugs. And in case if there is any changes in the hospital system or the content, it must be informed to the medical staff. The disadvantages are there. Personal opinion of some people may not be favored over here. So depending upon the socio-economic status and pharmacoeconomics, only the medicines are involved. Then the pharmacy hospital formulary management system, where the cost is decreased, assure high quality care, provide information, organization, policy, procedures, development of institution specific guidelines, protocol, formulary content and organization, information on drug, information on hospital policies, procedures, special information about drugs. In according with these objectives, the formulary should consist of three main parts: information on hospital policy procedures concerning drugs, drug product listing, special information, and in hospital policies and procedures, various rules, regulations, guidelines, conduct, constant law, solution, pharmaceutical jurisprudence, storage conditions, emergency medicines, prescription drugs, OTC drugs, pharmacy manuals, drug information services. Then products listing, alphabetical order and generic order, types of information, doses form, various APIs, pediatric dose, pregnant and lactating woman, FDA pregnancy categories are involved, and the anatomic therapeutic classification and various other. Special information, equivalent doses of similar drugs, LASA drugs, medical abbreviations, medical terminologies, list of sugar-free drugs, list of diazable poisons, metric conversion tables, poison control information, table of drug interaction, drug food interaction, adverse drug reactions, polypharmacy, missed dose, FDA pregnancy category, storage of medicines, and special directions for the use of the medicines, particularly H1, storage of medicines away from the children's, temperature sensitivity. This all way. Then Young's formula, Clark's drilling formula, metric conversion. For preparation of the hospital formulary, you should have a team. It is being prepared by the medical pharmacology department, by the community medicine department in a medical college and hospital, where the formulary have the title, page, name, number of the members of the pharmacy and therapeutic committee, table of content, information on hospital policies, procedures about the medicines, various medicines accepted for use at hospital, and this is how a hospital formulary look alike of a hospital which we run with. So in the contents, introduction, abbreviation, various medicines used, safety profiling of the item, interaction profile, adverse effects, pharmacokinetic profile, availability of the item, availability of dosage form, cost, acceptability of patients, efficacy for treatment of specific conditions, supplementary information on each drug, patient counseling points, storage guidelines, labeling information, brand names, prices, prescribing and dispensing guidelines, principle of prescription writing, reporting of ADR, prevention of ADR, general drug use, advice, miscellaneous section, child dose, renal adjustment, metric conversions, diagnostic aids, etc. are used. Your responsibility as a pharmacist come which medicines you should select. Medication adherence, formulary adherence, should not do as a pharmacist therapeutic alteration, should review and take action on all non-formulary drug use in the hospital. It provides a copy of the hospital formulary to all doctors in the hospitals. Involvement of the medical staff in various formulary implementing programs, give much advertisement and publicity to the formulary and revision of formulary. So this is how the formulary used to work up. And thank you so much, guys, for this patience listening. If you guys have any question, you may ask to me. And I would like to acknowledge Dr. Abhishek Pujikumar for helping me in this series. So Abhishek, any questions are over there? So we have a question again from Bikram Biniji, and he has asked this: if a person like having individualized drug therapy in case of chemotherapy or biologics, hospital formulary should have a standard dose or different. So in this condition, let me tell you, a pharmacist don't decide. In concentrated level, add chemotherapy or biologics, particularly the oncotherapeutics or an oncologist decide the dose. So it is dependent upon the patient what kind of radiation and amount of radiation is required for an individual suffering from carcinogenicity or mutagenicity in case of the concentration of the medicines. So that is what is done. So in case of that, pharmacist is not responsible. In chemotherapy or personalized medicine, so you are telling individualized medicine, the oncologist prepare direct and to the team. So it's a special care division pharmacy is required for oncology and oncotherapeutics. In abroad, particularly this typical setup, you have this kind of available facilities and infrastructure. Whereas in India, no such kind of things, but cancer ward is a special ward in the hospitals in the Indian scenario, and we are no such kind of problems to us. Okay, so any other questions, Abhishek? So as Abhishek has confirmed, there is no further questions. So thank you so much, all of you, and tomorrow we'll be meeting same time, 6:30, for next lecture of lecture number 13 and 14. So till that time, thank you so much, all of you. Take care, bye bye, and we'll meet tomorrow. Thank you for joining.